Title of the talk, as requested by Avdiki and Alana, was Management of Hyperactivity and Inattention Across Neurodevelopmental Disorders. Even as I wrote it, it's a big topic and a big wide spectrum of conditions. So I know just by being here that you guys are already many expert parents. So my objective here today is really just to review some of the things that we know can be helpful, but acknowledge that this is a pretty quick talk on a complicated topic. So bear with me a little bit on that. This is a great quote that I quite enjoy and one that I try to remind myself and families that I work with all the time. A child is a resource to be developed, not a problem to be solved. So whenever we go about trying to think about what's going to be helpful in adjusting behavior and helping out the kids in our lives, the kids that we work with, it's not about how we can fix the kids, it's about how we, as the individuals working with them, need to fix how we interact with them or the environment that they are within. So this is a schematic that I actually borrowed from a document that just came out from Integra, and it's just showing at the top there a range of behaviors that might happen in a classroom. And the schema that this was come up with was around learning disabilities, but I think it really does highlight the cadre of things that can be contributing to behavior that are relevant to neurodevelopmental disorders. I don't expect anyone to be able to read this, but it's just a very long list of all the kinds of things that can impact an individual that results in what are described as negative behaviors in the classroom or at home. It can be language impairments, cognitive impairments. It can be the environment. Is it too busy? Is it too chaotic? Are they tired? Are they hungry? Do they have attention and concentration or impulsivity problems? Do they have difficulty with transitions? There's so many factors that can go into why an individual acts a certain way that it's really important to always step back and consider those before we jump to conclusions about why an individual is doing something in a scenario. So as parents and individuals who work with kids, we always need to remember that. There's so many factors in what contributes to what's going on. And I think you as parents or people who work in this field, you know that for the individuals you work with, but you have to remember that other people do not necessarily know that, and you need to remind them of what the factors are for your individual child in trying to come up with good plans that help address some of these behavioral concerns. So specifically, I'm talking about ADHD traits. So inattention, and I'm sure this list is familiar to most of you, so I'm not going to go through all of it. But this is a little schematic, and really we're talking about difficulty sustaining, difficulty staying on task, distractibility, forgetfulness, problems with organizing, and generally having difficulty with task completion. I'm also going to touch on hyperactivity and impulsivity, fidgeting, getting up, moving around, on the go, talking, blurting out answers, not waiting your turn, interrupting others. And these are just two little cartoons, the one at the bottom. By the time I think about what I'm going to do, I've already done it. So these traits generally fall under the umbrella of ADHD. But what we know, all of us here, is that these traits exist really across a broad span of neurodevelopmental disorders because there's many umbrellas and how kids fit is quite fluid over time. So any of the traits that we think of that get assigned to this broad umbrellas of neurodevelopmental disorders, we know that they actually exist across individuals in varying degrees at varying times, and more importantly, cause different levels of impairment. So as I talk today about what I think will be helpful, I do somewhat come from a lens of ADHD, and that's going to be what some of my examples are, and I'm aware that that's not always what everyone comes with. So I do want you to kind of take some of these ideas, and I do realize that some of them need to be adapted and thought about in different ways depending on different profiles. So I know that, but for the sake of time, I'm going to sort of go through them, and at the end I'll sort of talk about ways in which you can think about these strategies in a flexible way for the individuals you work with. So the most important thing to keep in mind is this is not about motivation. This is not willful inability to do what people want. This really is a result of the deficits that exist in these individuals. And the analogy I often use is glasses. So it says up there, no matter how hard you try, it may be impossible for you to read these words, those little tiny words. And sometimes for educators and teachers, reminding them that yeah, you know what? Just like a child who needs glasses, if they don't have the glasses on, they may be able to squint and sit up really close and work really hard and ask someone to repeat it, and eventually they might be able to figure out what's written. But to do all that is so much more work than all the other individuals in the class, and it causes so much more difficulty for them. So by not actually addressing that they need that dealt with, they need help in their environment, that they need people to help them, and you wouldn't expect a child who couldn't see to not have glasses. And it's the same expectation in coming up with behavioral strategies and accommodations that are helpful for individuals who are struggling, because without doing that, you're really putting them at a disadvantage and making their world much harder. So, as I said, this is really just a broad overview of some of the toolkits that parents can use in thinking about strategies for addressing some of these traits and behaviors. So some of the underlying principles that are always good to keep in mind is that children do well when they can. And by that, I simply mean that you want to try to optimize the opportunities for them to be successful. And when things aren't going well and they're not being successful, you need to step back and say, what is it about this situation that is difficult for them? How can we allow them to do the best job they're able to do with the strengths that they have? Responding versus reacting. So what do we do in situations when things aren't turning out the way we want from a behavioral perspective? So rather than reacting, what is our response going to be, and knowing what that response is going to be before it happens. And as I've alluded to, it's about changing the environment, not changing the child. And so you really want to think about that. When things aren't going well and behaviors aren't the way we want them to be, you want to be thinking about what is it about this environment that we need to think about that's not working for the individual. So before I get started, I will say that self-care is very important, and so I won't go in for the sake of time, not going through it too much, but I really can't highlight this enough. Parents who are feeling overwhelmed and undersupported, it's very difficult to implement any kind of systematic plan. So particularly when things aren't going well and maybe parents have been trying things for a while, or guardians or caregivers or teachers, sometimes it's good to step back and think about who's trying to implement the program and what can we put in place to support them. So in trying to adapt the environment for individuals with attention, concentration, impulsivity, and hyperactivity, we know that structure, routine, and scaffolding are important. And you also want to remember their strengths. So as I go into some of these strategies, always remembering what the children are good at, what their motivation is, what is it that they bring that's a strength, because you can always get farther along in trying to do difficult things or implement behaviors by knowing what they're good at and what they enjoy, because that's always going to motivate people to work harder. So all of you here are sort of well-informed, and so this is talking about being their frontal lobes. And what it's doing is really identifying what we know the deficits are from a cognitive, neurocognitive perspective, and figuring out what they need. We know that individuals with these traits, with ADHD traits, can't keep track and remember things, which means the individuals in their environment need to do it for them. Using charts, pictures, lists, reminders, these are all really important. It's just harder for them to keep track of that information. So when you're dealing with kids who are able to, can you get them to say it out loud, repeating it for them, giving them reminders in a format that's useful for them, whether or not it's pictures, repeating these expectations, and if there's consequences attached to certain kinds of behaviors, making sure you remind them of that as they go into the situation. You want to repeat this information as much as possible in whatever format is useful for the individual you're working with to comprehend and understand. Also reminding them of what's coming up. So as individuals are working through things, letting them know what's been done, getting them to tell you what's been done, and telling them what's coming up next. Lots of reminders. Immediate feedback. So individuals who have ADHD traits, we know that they need much more feedback from their environment. So you need to be telling them information about 3 to 5 seconds after a behavior if you want to, or giving them feedback, whether you're telling them or showing them or giving them some sort of signal. So 3 to 5 seconds after a behavior if you're trying to reward it, which is really one of the strategies that we talk about, or if you need to give a consequence. You want to act swiftly to reward that behavior, praise it, correct it, or if a consequence of the behavior needs to be there. If you don't link that reward or that consequence with the behavior, it's just not actually going to be helpful in moving it forward and changing it or preventing it or increasing the likelihood the next time. So really how quickly you can do that makes a huge difference in how effective any strategy you're using is going to be. So just more on feedback, because it's really important. And I think sometimes people think that they can give feedback for a while or put a structure in place and that that's going to be enough. It needs to be all the time. This is part of the deficit. They do not do a great job of getting information out of their environment, and so we need to give them more feedback all the time to help manage and monitor their behavior. And that's going to change a little bit over development and over time. So occasional feedback's not enough. You need it to be much more frequent than for other kids. So it's just really important to keep at it and not wait, and really to give a lot of feedback and not be stingy with all the positive feedback and the rewards that go along with it. So our brains are Velcro for negative and Teflon for positive. This is really important to remember with anyone, but kids particularly. And how we go about interacting with kids, particularly those who are maybe struggling with some of the traits we've talked about, they actually receive a lot of negative feedback and not necessarily very much positive feedback. And we know that the negative feedback they're going to hear, even if they can't do anything about it, but the positive feedback they probably won't hear. The ratio we recommend is try to have 5 positive feedbacks to 1 negative. And that can sometimes be a lot of work, but parents and educators can think about many different ways to positively identify what went right. So rather than flagging what went wrong, what went right. If the knapsack was left on the ground, maybe not comment on that, and comment on the fact that the shoes went in the rack or the coat went on the hook. So how do we identify what went well and really praising the things that are going well? Because these are kids who get a lot of negative feedback in a lot of different places from friends and teachers. So coming up with a real repertoire of the things that are going well to let them know what aspects of them are really positive can be very important. And again, the ratio we aim for is 5 positives to 1 negative. We know that positive feedback is more likely to change behavior in a permanent way and be more beneficial overall than negative feedback. Not to say that negative feedback and consequences don't also have a place as well. So when you're giving positive reinforcement, so it can't just be random, it can't just be, that was good. You want it to be specific, you want it to be simple, you want it to be as often as possible, and you want it to be genuine. So you do want it to relate to what they're actually doing. Kids are aware when people are just kind of ing them versus saying, you know what, that's a really great job, you just made a good point, or you whatever behavior it is that they're doing, to really make it clear that what they did was great and you were aware that they did it. And we talk about finding kids doing things good, and sometimes it's difficult for parents to be rewarding behaviors that they think should be commonplace, but definitely kids with ADHD and ADHD traits, they need that. So, they came when you asked them to right away. Say that to them. I really liked that you came right away. I really liked that you are looking at me when I'm talking to you. Or whatever it is that you want them to do. Just because you expect them to do it or that they regularly do it, reminding them that they're doing a nice job is important. Rewards. So this is a busy slide, but it boils down to people often talk about rewards and will say that they don't work. That's because rewards need to be salient to the individual and they need to change all the time. ADHD children or children with ADHD traits, they need more reward. They need more information from their environment to keep them going. And so when you're doing a reward plan, you want it to be immediate, but you also want it to be salient. You need to change it up all the time and keep it motivating. You want to think about what they're interested in and where they are developmentally. And if it feels like you've got a plan in place and suddenly it stops working, sometimes you need to think about the reward. Do we need more? Does it need to be bigger? Does it need to be different? So really thinking about that, and rather than throwing out a plan just because suddenly it's not working, think about the rewards and who's giving them and how often you're giving them. The problem is that when individuals are doing it, sometimes we ourselves, if we're giving rewards to kids, it's a bit lackluster or we ourselves fall off of it. And in thinking about rewards, make sure you've got a plan that actually works, that the reward system is something that you can do easily, and you can do it consistently. Otherwise, it'll falter because you'll have promised something that you can't deliver on, and you don't want that to happen. So 2 big mistakes parents and teachers can make with all kids: too much talking and too much emotion. So depending on the profile, and as I said, this talk is really for a much broader audience of individuals with neurodevelopmental disorders. But when we talk specifically just about ADHD kids, often they do know what their expectations are of them. They just can't effectively do them. So just talking at them about what the expectations are is not necessarily what they need. They need you to tell them what needs to be done now, or what wasn't done in a simple way and without too much emotion, because the emotionality can really get in the way for the caregiver and the child in actually effectively having a behavioral program. So when you're using negative consequences, because there's definitely times when it's been clear that something needs to happen and it hasn't happened, you want to make sure that the individual, in whatever way it is that they need to understand, knows what the expectation is and what the consequence is. They need to be reminded of it, and they need to be told in a calm, neutral way, ideally when you're not in the middle of it having just happened. So you want to tell them what has to happen, what the consequence is going to be. You want it to be clear in simple language. And the consequence should suit the crime, as they say, and be naturalistic. You don't want big consequences for small things. There's certain things in life that if you just don't do them, there's a consequence. Sometimes you don't bring your books home, you don't get your homework done. Well, you're going to get in trouble perhaps with the teacher for not getting your homework done. And it all depends. You do have to decide for your individual child how it relates to that. And there may be other examples. But you do want sort of small consequences for small things, and it needs to be possible that you can do it immediately and follow through. The key with any of these plans is always following through. Do not come up with a plan that's not feasible for you, and you actually have to think about that. That goes into self-care. As a family, as caregivers, you need to figure out when you're going to implement a plan and make sure that you can do it at that time. So sometimes you might be out of your environment, visiting someone on vacation, and you might say, you know what, we can't actually do this in the way that we normally do it, and so you let up a little bit, because there's no point trying to have the individual follow a set of routines or behaviors if you can't actually reward them or consequence them in the way that's going to keep the behavior going. So you do want to think through it. Anticipating. So as parents of kids with neurodevelopmental disorders, I'm sure you're good at anticipating where things will go wrong. It's very important. You want to anticipate what challenges individuals are going to come up against in an environment or a setting, and anticipate it. Help prepare them, help prepare the individuals that they're going to be seeing and spending time with. So this is just an example, but I think that you can think through other examples. So, for some kids, if you're going somewhere, you want to talk with them beforehand, remind them of the rules, have them repeat them back if that's within their capability. Explain what reward might come from the behavior you expect, or if there's a consequence. Then you want to go into the situation, follow the plan, and follow through with the consequences. You want to anticipate what's going to happen and what's not going to go well, and come up with a plan rather than just letting it happen. So increasing the accountability of others. So this just goes back to the idea that it's not talking about changing the individual, it's about adjusting the environment. So we know that children with ADHD traits can't effectively monitor their behavior, and they don't do a great job of effectively monitoring the environment around them. They need other people to do it. So they need reminders when they're getting off task. They need reminders of what needs to happen next. They don't anticipate time or consequences very well, so you need to help them monitor their time and keep them on task. They need more supervision, and they need more check-ins, and this increased supervision and more check-ins is going to decrease the likelihood that their behavior is going to get them sort of far down the line of negative social interactions or negative interactions with more adults. Keeping a sense of priorities. So this is another really important thing. It kind of comes down to not sweating the small stuff, but as a family or a parent, figure out what things you really need to change. What's really a big deal in your family at this time to get done? And maybe think of the things that aren't such a big deal. Sometimes parents get caught up on what they think kids should be doing at various stages, but you know what? In your family, for your child, it just might not be important. So perhaps let some stuff go and really focus on what's important, particularly if you find like you're correcting behavior all the time about silly stuff, maybe basic chores. Let it go. Maybe they don't need to make the bed, but maybe you do want them to get their clothing on, or maybe it's something more simple than that. But what you want to do is figure out what is causing impairment for them or in their world and focus on that and not kind of try to focus on everything at the same time. So in dealing with problems, coming back to this is the idea when you have a lot of behaviors or a number of behaviors you want to deal with, you want to identify what it is you're trying to deal with, to address, to solve, to come up with a strategy. Then you want to pick the problem, come up with the plan, the alternatives, how things can go differently, how you need to change the environment, or what you need to put in place. Finalize the solution, try it out, and then evaluate. And then if it doesn't work, go back and tweak it some more rather than sort of throwing up your hands and thinking it can't be changed. It's a process. There's not often easy answers, and the first thing you try might not work. You just want to be consistent at it. And working together, and I know this audience here knows this, so school, child, family, partners, all the individuals who interact need to be on board with what actually works and communicating effectively. And school ideally will let you know what's going well and you vice versa, because that's going to optimize success overall. So individualizing the approach. I started off with this and I'll come back to it. You really want to think about what the strengths and interests are of the person who you're working with. What motivates them? Those are the things that are going to make a big difference in being effective for rewarding or motivating individuals to kind of come on board and maybe try things that are difficult or to adjust their behaviors. No one approach works for everyone. I often have families who want me to give them, a list of things to tell the teacher. The problem is that it really depends on the environment and the child themselves. I've worked with kids who can be rolling on the ground while I'm trying to kind of do an assessment with them. But by rolling on the ground, they're totally able to do what I'm asking them and engage in the task, and they can really get a lot of really great work done because they're moving around. Other kids, if the room is not completely silent and we're sitting at a table and we're locked together and I've got full eye contact, that's what they need to do to optimally perform. So you really need to think about the kids. What works for one individual, it's not going to work for another individual. Another example in the classroom is for kids who are really busy and quite hyper. One of the things that people often recommend is to put kids who've got attention problems at the front of the class. And for some kids, that can really help, and the teacher's there to give them feedback. But if they need to get up and move around, that can be quite distracting to the other kids. For some of those kids, actually having them a little bit sort of off to the side somewhere but still engaged can allow them to move around and not be disruptive in the classroom. So sort of thinking about what the needs are and realizing that not one solution is going to fit for everyone. And sharing with the broader team, your partners, your relatives, whomever's working with them, what's worked and what hasn't worked, so failures and successes, because that'll prevent teachers or caregivers from just retreading old ground. And every year's a new year, and every classroom or environment that kids are in is a new environment. So being a bit flexible about new places and figuring out what's going to work is important. So before you get started, any behavioral intervention is not a magic solution. It does take time and energy and ongoing adjustment. I would say that not throwing up your hands entirely is important, that just because something didn't work once doesn't mean that it can't work or there's not components that are valuable. And then the other thing that I would say is, as parents and caregivers, to sometimes things just don't work and you got to throw up your hands and dust yourself off and kind of laugh a little bit, maybe after the dust has settled, to say, what, that really didn't go well. But that's okay, because we're all human. And figuring out how to kind of say, okay, well, we don't want that to happen next time, so what are we going to do to anticipate this as we move forward? Thanks very much. So it's definitely an iterative process. I think it's important for us to realize they do actually need that frontal lobe help. And so you do want to be providing that for them, and as they get a little bit older, giving them a bit of independence, seeing how that goes. So there is a certain degree of trying to help them, because we do know the frontal lobes develop right through the lifespan, and that's going to happen with all individuals. So over time, there's going to be some benefits. But we do know that these deficits often do persist. So it's really kind of figuring out where their strengths and weaknesses are. And for some of these areas that are quite weak, parents are going to help them out quite a bit. And then as they kind of become older and more independent, figuring out what mechanisms they can use to help themselves out, whether it's technology or what have you. And so it is a bit of back and forth. But yeah, I often hear that. Parents are like, well, if I keep doing it, they're not going to develop it. There's a little bit of that, but also acknowledging that this is truly hard for them, and it may actually continue to be hard. It'll continue to develop by and large, but they will actually need extra help. And by taking away too much of that support, you're kind of setting them up for failure. So you do want to kind of pull back a little bit, see how they go, see how it goes, and then kind of, one step forward, see how it goes, and if needed, kind of put things back in place. So it's a bit back and forth. Yes? Right. So I think that really kind of goes back to this whole idea of planning and self-care. So I think as parents and guardians, we need to know what our capabilities are and what's going to be feasible and reasonable. So not coming up with an elaborate plan that's not possible in that environment. So always in any kind of self-care plan, you want to look at what are your resources, what are the other people in this person's world, how can you utilize that? And again, sort of perhaps focusing on one key area that's really important to both of you, and then figuring out, what you need to do to make this plan successful for your child, and vice versa. So I think just being very aware of what's actually capable in any family setting, because there's lots of variables that go on, the same with school. And so for some individuals, it might be really working hard to make sure that some of the other environments have all of this in place, and at home really only focusing on one or two things that are really important in that home environment to be successful. So it has to do with managing what's feasible and coming up with a plan that can actually be seen through from start to finish. Yeah. Yes? Yeah. Mm-hmm. Absolutely. Yeah. So definitely, lots of kids with ADHD or ADHD traits have sensory issues, and the degree to which, as I said, in some cases, kids have sensory overload. So those are the kids who can sometimes do much better if it's actually really. But other kids, they can utilize that moving around, that motor activity actually helps them to attend to what you're doing. And so, yeah, I think it does feed into sensory, but, sensory issues itself is a wide spectrum, and how kids manage that. Sometimes more sensory input can be helpful, and other times you need to limit it. So, yeah, thinking about how that works and what's beneficial. And sometimes it's trial and error. Yeah. Yeah, I mean, fidget toys are another example. People ask me about fidget toys all the time. And for some kids, fidget toys are really great. It really helps them attend. And for other kids, they're just a disaster. They're just a distraction. They end up doing things with them. They get thrown. And so really kind of thinking about that individual. And sometimes you need to try it out. And, fidget toys is a wide swath of different kinds of things. And so you need to think about the individual and how they're going to use it and where it's going to be and what it's going to look like. But for some kids, it can be really helpful, and for other kids, a disaster. So you do need to try some of these things out and not just kind of go with a recommendation because someone's given it to you, and sort of think about what the benefit or what the utility is for that individual. So there's three main resources I pulled from here. They are mostly those that are targeting ADHD, but I'm sure that there is others that are sort of more specific to kids with ASD. If you're waiting for a systematic intervention program, you may kind of implement some of these, but then once you're working with someone, they'll kind of come up with a plan that you can utilize. For sure, you want to be consistent in any approach you choose to use. So the 3 individuals that I was recording here were Ross Green, Lives in the Balance, 123 Magic by Pelham, and Russell Barkley. These are all sort of individuals who've come up with behavioral intervention plans that do start generally with kind of ADHD, these kinds of traits, but can be applied in broader audiences. But for sure, I think that there are special scenarios to keep in mind. And so those are some resources you could look at in the interim as you kind of think about this. But I would say kind of peruse the different ones, find one that seems to fit with your parenting style, and then stick within that framework rather than kind of trying to apply 2 or 3, kind of look at some of these approaches and then stick with one approach for a while to see how it fits, because it sometimes depends on your parenting style as to what kind of approach is a best fit for you. And that's important too. Sometimes people will be recommending things that are not a good fit with your parenting approach, and if that's the case, you might want to step back and see if there's another way to go about something than trying to, squeeze a round peg in a square hole.